Hi, so that's Dr. Ben. Next one is both an update and a question. Or whatever, call it a question. So the question came from Jane, and Jane had a paper and wanted me to have a look at it. And it's a doozy. Yeah, here we go. So this is from the Journal of the American Medical Association. It's called Universal Masking in Hospitals in the COVID-19 Era. And it's written by a bunch of people with MD after their name, but also a doctor of nursing practice, if that's what DNP is. Yeah. All right, what what have we got here? So basically, they're saying that one of the sentences is that we know that wearing a mask outside of healthcare facilities offers little, if any, protection from infection. Now, all right, what's my problem with that thing? Well, all right, in science, if you are going to make a statement, you have to justify that statement somehow. So you're going to say a thing, fine. And then, so if I were to say mask wearing doesn't make a difference, whatever, then at the end of that sentence, you have to say where you got that information. And so where you got it is either going to be from something like a figure. Like if you've done a test and you had 5,000 people with and without a mask, and you looked at their infection rate in both of them and saw, no difference, then you could say, here, based on this test, in these conditions, this is true, see figure 1, and that'll be figure 1. The other thing you can do is look at somebody else's paper where they've done this, or where they've modeled something, and you cite the reference. And you say, all right, go look at this person's paper because this person came to this conclusion, and the data's there, and you've got to look at the data, otherwise, you are not allowed to believe anything in science. That's the way it works. Those are the rules, yeah. And we have these rules in place because this is how you build useful things. This is how you do useful things. So right now, we were doing the math last night, and it's just, I didn't realize it was this bad. So we've got 100,000 deaths in America from COVID. We're probably undercounting that because there are people that have died and have not been tested and could be. And the overall spike in the death rate this year is bigger than the overall amount of known coronavirus deaths. Factor in the fact that people have not been driving much and haven't been doing all the other things that get them killed on a routine basis. And this is probably an underestimate, but let's take it as fact for now. Then you've got, it's a bit over 300 million in the U.S. People that are alive now. And so what's 100,000 out of 300 million? That's 1 out of 3,000 people in the U.S. has died from COVID already. And we're not done yet. And that's probably an underestimate. It's probably more like 1 out of 2,000 people has died. These are numbers that you don't see outside of wars, and wars that go fairly badly, at least for a while for the U.S. Yeah, these are really, really high numbers, and worth thinking about, I think, when we're, talking about this stuff. Anyway, so throughout this paper, which is, it's a perspective, so it's basically an opinion piece, but it's appearing in a highly visible place, and so, once again, it's one of these things when if you have a loud voice and you're going to reach a lot of people, you want to be careful that what you're saying is not going to do more harm than good. At least that's the way that I think works best and what I'm trying to do. So whatever dumb thing you may happen to believe deep in your heart, you gotta put that on the shelf, because when you're talking to the people, it's public service, and you've got to try to act like a responsible public servant. Yeah. So anyway, here and throughout the paper. So the paper is about mask wearing, and they don't ever cite any reference for mask wearing. And there are plenty of studies now where they've looked at masks on mannequins, just like how much is blocked on transmission, masks on regular people, what does that do to respiratory droplets. They've done lots of modeling studies, like what happens if you wear a mask, you're controlling airflow by this much from this place, where a certain amount of virus comes out. How does this change the projection? I mean, there are a lot of ways to come at this problem, but coming from no data and a gut feeling is not the way you want to do it. Yeah. Doctors and nurse. Yeah. So there are actually 5 references that are cited in the paper 3 of them are about asymptomatic spread, and they all show that to some degree the virus can be spread asymptomatically, although it's not spread by every single asymptomatic person. So yeah, it's just that it has been documented in some cases. And the other 2 are about travelers returning to other countries from Wuhan, and how many of those had the virus at the time estimate. But none of those has anything to do with a mask, and presumably most of these people returning from Wuhan would have been returning at a time before mask wearing was widespread. Here, there, or most anywhere. So, yeah, it's just I don't know. It's a paper that starts from the wrong conclusion and then works to kind of justify itself, and it's partially going off in a different direction. But I don't like that there are people doing this because, yeah, in a country where 1 out of about 3,000 of us are dead, because of this thing, it just seems irresponsible. We put up with a lot of stuff. We put up with going in one side of the supermarket and out the other side. We put up with those little 6-foot apart stickers in lobbies everywhere. And those do something. They might help a little bit. But if you look at the modeling, they pale in comparison to mask wearing. If you could just get people to wear masks, that's the one gigantic driver that is most likely to lower the number of cases. And coming out in an article like this, in this place, highly visible, talking to doctors in hospitals, and basically trying to convince them that mask wearing outside of the hospital is nonsense. Doctors are people that the regular folks are going to look to for advice. And if you're filling doctors full of bad advice, I mean, you hope the doctors can look around and make their own opinions, but not everybody has time for that all the time. They're doing a pretty busy, important job at the same time. And so, stuff like this annoys me a lot. Yeah, it's these are steps backward rather than forward. But I get where it's coming from, probably from personal experience. I haven't worn a mask and I'm not sick, therefore nobody should wear a mask because nobody's sick or whatever. I don't know. It sounds dumb when you articulate it. I'm not sure there's a way to articulate it that doesn't make it sound like that. Anyway, there you go. That's my 2 cents on this. And if you're out there and listening, just wear a mask. It's not that bad. It's annoying. Yeah, I hate it. Sometimes I get a little panicky when it's hot outside. I have to just go sit in the car for a minute and take the mask off and just okay, breathe a little bit. There we go. Okay, now I can try this again. And air conditioning really, really helps. Air conditioning, number 1 invention as far as I'm concerned. Thank you very much. This has been Ask Dr. Ben.